Also called labyrinthitis or acute peripheral vestibulopathy, this condition is characterized by brief, severe vertigo, nausea, vomiting, and imbalance. This is typically attributed to an acute or post-viral inflammatory disorder of that vestibular portion of the 8th cranial nerve. However, MRI studies really only reveal a pattern of inflammation in patients with vestibular neuritis, so this may or may not be a result of a viral infection. Along with the previously stated symptoms such as severe vertigo, nausea, and vomiting, and imbalance, patients will likely exhibit unidirectional nystagmus, a positive head impulse test, and absent vertical or diagonal skew. These are all symptoms that will help differentiate between peripheral vestibular dysfunction or central vestibular dysfunction, such as what may occur in a cerebrovascular event. Patients with vestibular neuritis generally experience significant symptoms for 1 to 2 days, followed by a gradual decrease and return to equilibrium. However, the acute illness rarely lasts more than several days to a few weeks. Residual imbalances and dizziness actually may persist for months, and it may be nice to note that the patients typically only suffer from one of these episodes during their whole life. The diagnosis of vestibular neuritis is largely based on clinical presentation with examination features consistent with what was discussed previously, and there are no real diagnostic tests for this. Neural imaging may be indicated only to rule out an alternative diagnosis if the exam is not entirely consistent with a peripheral lesion. That obviously means that a good history and a good physical exam is absolutely necessary for this diagnosis to be considered. There's really no evidence supporting the use of antivirals in patients with vestibular neuritis, and the use of glucocorticoids, though, may be used still, for this is not currently the standard treatment or the current recommendation. What we really want to do for this is initially treat the vertigo, nausea, and vomiting. And for this, we'll use medications like first-generation antihistamines, antiemetics such as ondansetron, metoclopramide, and even benzodiazepines like alprazolam and clonazepam. Vestibular rehabilitation has also been shown to be effective in improving symptoms and functioning, and is most likely to be when the patient is referred for a vestibular physical therapy evaluation and completes an individually tailored program.